More than 700,000 Wisconsin residents will be signing up for the health insurance through the new online marketplace set up by the federal government. And that includes 92,000 people who will be losing Badgercare coverage in January. But navigating your way through the insurance exchanges can be a little confusing and maybe slow. Brynne McBride from ABC for Health is here to answer some questions. Thanks for coming in. I imagine you've just been bombarded with questions like who has to sign up for this?
Sure. Thanks for having me. It's a really exciting time.
Sure.
But you're right. There are groups of people that health reforms marketplaces apply to. There are groups that it doesn't apply to. If you're a senior citizen, you probably don't have to worry too much. If you have Medicare, you're not going to go into the marketplace. If you have insurance through work, which a lot of folks in Wisconsin compared to other states don't necessarily have to go into the marketplace unless you're really unhappy with your insurance through your work. Then there are options. People we're talking about, the people you mentioned when we started, there are 500,000 uninsured folks in Wisconsin. They're going to want to find their way to the marketplace, which is where they also could see if they're eligible for Badgercare Plus in Wisconsin. That's one path that could take you to either program, and the 92,000 parents losing Badgercare Plus.
If they can log on to this website, what will they find and what do you have to do?
That's a great if right now, because your viewers know if yesterday was go time. As the federal government was shutting down, the health reform marketplace was starting up. And it was a little bit of a logistical challenge. There were, as you know, over 2 million people tried to hit the site, and that was within the first hour of it being operational. People then slowly, once they were getting that please wait screen, started to slow down. There are states that are doing a state-based exchange. New York State has their own marketplace. They had over 2 million hits in the first hour and a half of them being operational as well. So let's assume you get through. You're going to find a listing of health plans. You're going to enter basic information like you would if you're applying for any other program, or even if you're shopping online. If you've ever bought a sweater online, you're going to enter your information. You're going to answer some questions about where you live, and then you're going to go down the path of your income, your family size, and that's how it starts sifting. Now, this is an interactive marketplace. It's going to verify what you say against Social Security's information. It's pulling information from other agencies as you're putting information in. So you're going to go through that process first. Then you're going to get to the actual plan information. And this is where folks need to take a little time to slow down and actually read what the plans are offering. If you have a lot of chronic health conditions, if you take a lot of medications, you're going to want to make sure you're aligning yourself with a plan that would cover those things. So there will be variations among the plans.
I know they're like, and they're kind of based on Olympic medals. There's gold, silver, and bronze.
And then there's the platinum.
And the platinum.
Yep.
Let's say I sign on for the gold program.
Sure.
And then later on, things improve, or maybe I come into some more money. Can I change plans? Or once you're locked in, are you locked in?
So picture this the same way as if you would just go right now and buy an insurance plan. So you're going to have to abide by the terms of that plan. So this is open enrollment right now. So it's the equivalent of open enrollment in a workplace when you're buying insurance or having insurance. You sign up now. You sign up before March 31st. After March 31st, you're in that plan until the next open enrollment period.
Okay. Now, there's, don't panic. I mean, there's plenty of time to sign
up. So that's, we want people to know yesterday was a little chaotic with signing up on the marketplace. When 2 million people hit one website at once, it gets a little crazy. The next deadline that we should keep in mind is November 15th. Make sure you've been to that marketplace by November 15th, and that's the date then that you have to be signed up in order for your coverage to start January 1st.
Okay. Good. All right. Good information. And I'm sure we're going to call you back, Brynne, to answer some more questions.
It's an amazing time for healthcare.
It really is.
Amazing
It
time.
really is. Okay. Well, thank you.